Greg is in New York. You're on Free Talk Live with Ian, Ellen, and Daryl.
I used to call in the past and really talk about decentralizing organizations and stuff like that. And I just kind of wanted to talk about the other way, which is why things might be good to be centralized in some areas. And
which areas?
Right. So I think, in a nutshell, the role of government, and this is why I consider myself a minarchist, the role of government is basically to ensure that people's minimum expectations are met. So what I mean by that is, like, 2,000 years ago, people didn't expect that water would come to their house, or that they would have relative safety, let's say, within a certain area. Whereas, fast forward to now, we expect having the internet and having water and stuff like that. We expect education for our kids. We expect minimum health care and stuff like that.
I don't know. I would say that in the Roman Empire 2,000 years ago, they did have running water. So people in certain parts of Rome would expect to have running water. In certain parts of Rome, they would expect to be protected from savages.
In certain parts, yeah, and aqueducts were public projects. So that's actually a good example of a public good. But, okay, maybe Rome was not the best example. But certainly other societies didn't have water coming to their house. What I'm trying to say is that our expectations for everything from healthcare to education are rising every 100 years. They're constantly getting to the point where we wouldn't be happy living the way that a 14th century person would be living.
Well, I think that's kind of subjective. Some people might enjoy that. I mean, a lot of people that live in New Hampshire like the roughing it lifestyle, and I'm sure that people would adapt to it pretty quickly if it meant that they could live out their lives doing what they find enjoyable. I mean, it would take a lot of advancement away, sure. Like, there wouldn't be as great technology. Like, you probably couldn't use your cell phone anymore, but it would still be, a lot less stressful than what people are used to now.
Oh, I totally agree with that. I mean, there's a lot of people that would love to live out in the not necessarily in the wilderness, but out in nature. But at the same time, if you get some kind of infection, you do appreciate that you can go see, you could travel and go see a doctor who will maybe save your life.
Oh, sure.
Mm-hmm. Which has nothing to do with the government, but okay.
Well, that's what I'm trying to say, is that if everyone wants something, for example, access to basic health care like that, then it makes sense for everyone to collectively bargain for that thing, because...
But that's not what happens with the government. I mean, with the government, you've got people who are politicians who do not have your best interests in mind. They have the best interests of the corporations and their paymasters, their controllers. They have their interests in mind. So the idea that you're using the government to somehow collectively bargain is ridiculous. And when you use the government to provide services, you're relying on a monopoly, which by definition is inefficient and in a lot of ways, can be abusive. It's protectionist.
Well, hold on.
I think
the government that we have today is not a minimal government, first of all. Mm-hmm. And we don't have, when you have a monopoly, when you say it's inefficient, in this case, this is something called a monopsony, which is the opposite of a monopoly. It's basically one buyer. It's like a single buyer for healthcare, for example. And what happens is this single buyer can negotiate a better rate than if all the grandmas are competing against each other to get that same healthcare.
Well, that sounds like a fantasy. I mean, what is the evidence you have that when there's no competition that you can somehow negotiate a better rate?
Oh, that's basic economics. I mean, there's tons of evidence for this. For example, Medicare is much more efficient in terms of the prices it gets than pretty much every other insurance company in America.
Have you ever actually talked to doctors who accept Medicare?
That's the point. They're squeezed by Medicare.
Squeezed to the point where they have to make up the difference by charging cash clients more. So in a lot of cases, the Medicare won't even pay for the services that that the doctor is providing, and that's why more and more doctors, from what I understand, are considering and/or are leaving accepting Medicare and even accepting insurance in a lot of cases.
Right. There's a lot of problems with American healthcare, but if you look at the correlation, this is about as strong as it gets. All across the world, in every developed country except America, healthcare costs are much lower. And if you look at all of them, all developed countries in the world, they all have nationalized healthcare one way or the other.
And they all have incredibly long wait times for basic operations that in the U.S. you would wait maybe like a week. In Canada, you're waiting months.
In Canada, maybe, but if you look at other countries, there's actually some of them have much better outcomes than the U.S. Some of them have more doctors per person than the U.S. How is that possible if you're saying that it's much less efficient? In other words,
you're comparing one broken system to other broken systems, so it's inevitable that some things are going to be less broken than others about some of those portions of those systems. So I'm not a fan of the current system in the United States. I think it sucks. And if you want to become a doctor here, you've got to jump through a bunch of ridiculous hoops that have been put up by the American Medical Association that prevent competition, that prevent people from getting out there and offering services, prevent nurses who can do the same things in a lot of cases that doctors can, but they are not allowed to do those things unless there's a doctor present or something like that. So there's all kinds of rules that restrict the marketplace and restrict the supply of doctors here in the United States. We could have more doctors if there weren't as many rules that the government bureaucracy has put in front of them to prevent them from getting into business. And the AMA, which is a cartel essentially of the doctors.
Right, but if you think about it this way, it's really just an easy, quick solution to a problem that everybody has, which is how do you choose who to buy from? Like which hospital you're going to go to. Like you want the best care, and it's more reassuring if a hospital that you go to is like publicly funded by Medicare or...
Is that more reassuring?
To a lot of people it is.
To some people.
Because they're like, oh, this person's licensed, and look at all of these customers that they have. They must be okay. Because they don't want to take the time researching each individual doctor. They don't have time for that.
And if you're only comparing, the per capita rate of doctors in one country to doctors in the U.S., the state of California, as I understand, has more lawyers per capita than anywhere else in the country, but that doesn't mean that the legal system in California is the best in the world.
No. Outcomes are. I agree. If outcomes were not better, then it wouldn't matter how many.
But let me give you this one, Greg. Let's say that you're right about. Let's say you can find some country that's got better numbers in a lot of different areas in healthcare. And it's doing the government healthcare thing, the single payer, the universal healthcare, whatever you want to call it. And the United States, is lacking behind that particular country. Without getting into the details on those things, I am not willing to put the ends in front of my means. I'm not willing to use violent means to get to those ends, even if those ends are more efficient. We can come back with more if you want. Hang on, Greg. 855-450-FREE. That's Free Talk Live. All right, let's go back to Greg. He's in New York. And Greg, you were talking about, we ended up getting off sort of on this healthcare subject, but you were also talking about the minimum role of the state. And I'd like to come back to that in a moment, so I don't want to lose track of the original thrust of what you were talking about. But when it comes to the healthcare discussion, it's easy to get lost in the weeds of all the statistics. So, for instance, Daryl said that the universal healthcare it's slow. You've got to wait a lot of time in Canada. And then you said, well, that's not the case in all the countries. And then you pointed out that in some countries there's more doctors per person than in the United States. And, there's all these statistics thrown out. Nobody really knows what the truth is. Who's got the right statistics? I don't know. And, of course, statistics can always be manipulated. So getting bogged down in all that is kind of pointless. To me, even if it's true what you're saying, even if it's true that there's some socialist country out there that's got a better system, and by the way, I think this system's terrible in the United States. It's a mostly government operated system, a mostly government funded system, and it's highly government regulated. So what we don't have in the United States is a free market in healthcare, and we're nowhere even close to having a free market in healthcare. So again, we're just comparing cancers as far as I'm concerned, comparing these different healthcare systems. So my point is, in the ideal libertarian world, or a liberty-oriented world, the healthcare would not be provided by the state. It would not be a one-size-fits-all solution determined and dictated by some board of bureaucrats somewhere. It would be an open marketplace, and there'd be all kinds of different options. You'd be able to price around, get good prices. Presumably there'd be enough doctors available. And the thing is, even if a socialist country was doing it for less, was managing to outcompete the free marketplace, I still wouldn't support it because socialism is based on the threat of violence. You're forcing people to pay for a system that they may or may not value. And as long as there's force involved, I can't be on the side of it. I don't care if the results are better. And some will say that makes me a crazy ideologue, but I can't justify using force on my neighbors, and I don't see how you can.
No, and I feel the same way, but I think there's a lot of people that end up going to the hospital and expecting care because they're in pain and they deserve the help, but they can't afford to pay for their health care.
Mm-hmm. Well, and there's a law that's been on the books for years that says that a hospital or a doctor cannot refuse treatment if someone is there, whether the person can pay or not.
I don't think we need laws like that. I think that hospitals have charity wings. They're known for that in the past. Doctors have been known for donating their time. There's certain, like in the charity wings, doctors will frequently spend time there on their own volition because it's the right thing to do, and they want to help the community. I mean, so we don't need to twist people's arms and threaten them with jail cells in order to get people to do the right thing. But that's essentially the argument behind the state, Greg, and that's what you're supporting here, right? Is the threat of force.
First of all, I want to say thanks for the kudos about the caller thing. I really enjoy calling as well. And listen, I think there's two different conversations whenever I call in that we just have to be aware that there are two different conversations. One is about outcomes and what actually might produce a better result in reality, having been tried. And another is about principles. And like you said, even if it produces better outcomes, it may not appeal to you to live in such a society, even if the outcomes are better for most people.
I can go down and get a good outcome by putting a gun to a bank teller's head and get several $1,000s out of their teller tray. I mean, that's a good outcome for me.
For everybody, obviously.
But
that's debatable if that's a good. Anyway, so my point is, it's kind of a little bit like if you're in the software world. If any of your listeners know about software, there's the free software movement, which was the original thing that basically they invented the GNU Linux and stuff like that. And then there's Linux, invented by Linus Torvalds, who didn't care about this, and the open source movement, which is different. It cares more about, it doesn't care about the principle necessarily of being free. It cares about the practicality of open source and the fact that you can look at the source. And so it doesn't necessarily even force you to make your derivative software free. And basically,
but in neither. Hold on. Yeah. In neither one of those instances is anyone being forced to use those softwares or use those operating systems.
I agree. But the relevant thing here is not that nobody's being forced. In either one, nobody's being forced. But it's whether you care about principles or whether you care about outcomes. And for my part,
as long as there's no force, it doesn't matter. But as soon as you say that you want to kill somebody or have somebody thrown in a cage for not paying taxes or not paying for the services that you think are needed, then it does come down to force.
Greg, of course you don't want to kill anybody. Everybody who supports the government will say they don't want to kill anybody. And it's certainly true that the police will try to avoid killing you first. They'll certainly try to tase you and beat you before they'll kill you in a lot of cases. But ultimately, behind every government program is the force of a cage or a gun or a club or something like that. And you may not be the one employing those violent tools, but there will be men who will do that, and you won't be the one asking them to. But ultimately, the supporting of these government programs is essentially aligning yourself with the threat of violence against people, and it's just not okay.
I understand. No, I understand what you're saying, and just in the interest of time, you're focusing on the end where the taxman cometh and then he sendeth the police officer after you. Yes, but look at the other end where the guy got bit in the wilderness and now he needs to go to the hospital. He has no money to pay because he's been in the wilderness for all this time. Does he have a right to health care?
Ask for help. No, he does not have a right to health care, but people should help. People who care about others should help, and I think there's a lot of human beings who care about others. I'm sorry?
So the law you talked about in 1985, in the 80s, there was the COBRA law, and the omnibus bill said that because there was few high-profile cases where patients were turned away at hospitals for inability to pay, and by the time they arrived at another hospital, they died. And so the bill was basically because it wasn't the hospital that should front necessarily that doctor or that time to help this person. Those resources should be figured out down the line, by the society. But I'm talking about the minimum, the basics. I'm not talking about letting the guy do plastic surgery on himself. Just the basics.
It doesn't matter, man. It doesn't matter what the minimums and the basics are. As long as you're threatening people with violence to fund your minimums, it's inherently immoral to me. It's not okay to go around and put guns in people's faces, and even if you're going to use the money to help your grandma who's sick, it's not okay. What's okay is to ask for help. What's okay is to request, to persuade, to cajole.
Of who? No, but of who? There's two ends of this. One is the police officer who threatens the deadbeat guy who doesn't pay taxes. Sure, fine. But on the other end, there's a guy dying in a hospital because he got turned away because the hospital didn't have the resources.
So open a hospital that doesn't turn anyone away, and let the hospital that turns people away have a terrible reputation, and let them lose in the marketplace rather than using violence to try to force them to do business in the way that you want.
St. Jude provides health care to people that can't afford all the time.
The Shriners.
That's what they do.
The Shriners do burn care for burn victims. Greg, thanks for the call tonight. I appreciate hearing from you.
Yeah, and the same thing could happen at a local scale, except for all the regulations that are in place.
That's true. Toll-free number, 855-450-FREE. You can take control here. You can share your thoughts on the healthcare system or whatever's on your mind. Still to come, the 7 strangest, according to Salon and Alternet, libertarian ideas. We'll dig in moments on Free Talk Live. So for those of you just tuning in, we had last hour kind of shared the preface for this Salon/Alternet piece called The 7 Strangest Libertarian Ideas. And of course, as usual, they invoke the name Rand Paul, which of course has nothing to do with true libertarianism. The idea of libertarianism being that you should be free to live your life how you want so long as you don't hurt anybody else. And that, there's this thing called the non-aggression principle. The idea is very simple that, it's not appropriate to aggress against people no matter what your goals are. We just had a conversation with Greg in New York where he was talking about the minimum that government should provide to people, the minimum health care, not plastic surgery, just the minimum in order to survive. We need to have these things. Running water, we need governments to provide these things because when we buy in bulk, then you get a better price. But it doesn't really work out that way with governments when they buy things.
I obviously I'm not old enough to remember when Nikita Khrushchev was in charge of the Soviet Union, but I have certainly seen the video where he was banging the shoe on the desk because the heel was placed on the wrong end of the shoe.
Oh, really?
Where, like dress shoes, they've got the little, quarter-inch heel that's put on the back end.
So they did it wrong.
Right, because where's the incentive to do a good job? They get paid the same regardless. The shoes cost the same regardless because there's only one company making shoes in Soviet Russia.
Well, yeah, that's why there's such long lines at the DMV.
That's another thing is like, well, and we didn't go there with Greg just because he's a great caller, but can't keep him on the entire show. But it begs the question, I think, of, well, if government must take care of things that are the minimum, then why aren't they running the grocery stores? I mean, if that's
they have the FDA and they have other organizations that regulate food safety.
Yeah, but they're just regulatory functions, right? Like that doesn't get the food into people's mouths.
Right.
Why don't they? If it's so important, I mean, healthcare is important. So if it's so important to be fed, and on Maslow's hierarchy of needs, that's definitely up there.
Yes.
Water. They provide
on the bottom,
water.
The very bottom basis for
it's the thing you need a lot of before you start worrying about other things.
Right, just basic survival.
Arguably, not quite as important as water, right? But pretty darn close.
Right.
Like right up there. Governments provide water. Why shouldn't the government run the grocery stores? And we know the answer to that question. It does a terrible job of running a grocery store, of distributing food. Bread lines are a perfect example of that.
Yeah, just look at the Great Depression in the 1920s.
Well, the argument, of course, would be that it was all done wrong. The socialist argument would be that, well, the Great Depression or the Soviet Union, this was all wrong. They had the wrong bureaucrats got elected. If they would just elect me, then I would solve everything.
In Soviet Russia, there was more people dying of starvation than anything else.
Right, and there was a saying when Stalin was in charge. There was a saying, if Stalin only knew. Because they thought that Stalin was the benevolent dictator, and if he only knew all of the problems, then he would fix it.
I have never heard that one.
Well, yeah, he was the man of steel. He was he was godlike.
Same thing in North Korea.
Yeah,
I mean, they worship Kim Jong Il and
Kim Il Sung,
and now not so much with Kim Jong-un. They're not as enamored with him, but over the decades they've treated these dear leaders as though they are godlike almost.
Yeah.
And for instance, the official propaganda is that Kim Jong-un, the new guy, that he's in there. I remember saw one of these documentaries about they opened up a new health fitness thing, and that it was Kim Jong-un who came in there and personally inspected all of the fitness equipment.
Not all of it.
That's right.
They have little red plaques on the stuff that he inspected, and people don't use the equipment that doesn't have the red plaque.
Right, but I'm sure there's some, private company or people that went in, inspected it first, and they're like, okay, just look at these ones. And he'll just walk over there and pretend like he knows what he's doing. Put on a nice show.
If they make a show of it at all, rather than just making the claim, yes, it was the dear leader who inspected all of this. Because they also claim that the dear leader designed the entire facility as well. He's an architect.
And the workout routine.
Right,
yeah.
and,
so
and
that there's
airplanes
the certain...
were invented not so long ago either.
Yeah, there's the certain
by
routine.
The dear leader.
Right.
There's the certain routine where you use all of the equipment that he inspected, and you use it in sort of a rotation, and that is the best workout because that was dear leader's workout.
They'll probably give you whippings if you don't do the dear leader workout, but I'm speculating on that one.
Or they'd just be like, oh, well, I mean...
You don't love the dear leader as much as I do.
You must not be, as good at working out. You must just be lazy.
Have you guys ever seen the footage, and I think it might have been the same documentary, where they go into one of these show stores?
Yes.
No.
It's so creepy. They have these stores that are sort of made to appear as though they're like a department store. They have products in stock, but they don't actually sell anything to anyone average. I guess they will make a sale to a tourist or something like that. But the average North Korean folk cannot go into these stores and purchase products.
Wow,
and there's only one or two items deep.
Right. On
where
the shelf.
Normally the shelves they'll have it, all the way back.
Right. Well,
they've got one or two.
Right, it's like a cardboard display of the
That's
mountains and trees in the background.
Okay.
Well, yeah, I'm just saying it looks like it could be real, but it's not really. But I've heard reporters will go to North Korea after going through this long approval process where their whole trip is planned out, so they don't get many tourists, so they don't really need to put a lot of effort into the show that they're putting on, but they've got pre-planned routes and they keep They keep all of the natives from talking to these people because then they'll find out about the death camps and there's prisons where they will send you if you turn against the leader in some way.
They will send you if your second cousin turns against dear leader.
And they keep your children there as well.
Yes, crazy.
It's multi-generational.
3 generations.
So, yeah, there's a lot of crazy in North Korea.
There was a good documentary that was done by National Geographic some years ago.
In the 90s.
Where they went in with a medical crew.
Mm-hmm.
And the medical crew, they were doing cataract surgeries on people. And they were filming the removal of the bandages from these people after having their cataracts done, and the people were going up and bowing to the picture of the dear leader and praising the dear leader for the surgery that the doctor did.
Had provided.
But he gave the technology for the surgery, right?
Probably.
And the camera crew was able to sneak in to one of the houses of one of the people, and all of the pictures on the wall were pictures of dear leader and of Kim Jong-il.
I wouldn't want to look at those faces all day. Ugh.
And so Lisa Ling, who was the reporter that snuck in with the crew, she asked one of the people, she said, which one is your favorite picture of dear leader? Oh, they're all my favorite.
All equally. I love them as much.
Can dear leader do anything wrong? And the response was, I don't understand your question.
Yeah, it's outside their paradigm. Toll-free number, 855-450-FREE. I don't know how we ended up getting off on North Korea, but the point was, I'm sure
monopolies.
The socialists would say, well, they're doing it wrong. Just put me in charge. Or my favorite socialist. And
everybody's
then it'll be
a little tyrant.
Paradise. 855-450-FREE, because force is a great idea.
Free Talk Live, 7 nights a week from 7 to 10 Eastern, live on the Liberty Radio Network at LRN.FM.